And with the other parties here, let's call the meeting to order. I'm Roger Christian, the Chair of the Board of Health.
I'm Carol Ahern, board member.
Jason?
Chair Orsini, Health Director.
Okay.
Jason Belmonte, Food Inspector.
Lorraine Donovan, Administrative Assistant.
Great, thank you.
Jared, you have to read the statement.
I have to read the statement. Okay, so pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, Mass General Law C 30A 18, and Governor's March 23, 2020 emergency order imposing strict limitations on the number of people that may gather in one place, the Board of Health meeting will be conducted via remote participation by the board. The meeting will be live streamed by Westwood Media Center, and the public can view the meeting by accessing the link on YouTube. Our government channels will be broadcasting the meeting on Comcast Channel 12 and Verizon Channel 42. The public is encouraged to watch our meeting via the Westwood Media Center live stream. The public will be allowed to make comments if they wish to do so during the portion of the meeting designated for public comment by using the conference call number as listed below. The chair will continue to give guidance and instruction as needed. Every effort will be made to ensure that the public can adequately access the proceedings via technological means. In the event we are unable to do so, despite our best efforts, we will post on the town website, www.townhall.westwood.ma.us, an audio or video recording or transcript as soon as practicable after the meeting.
Thank you. We already have the Westwood Media Center recording this. Is there anyone else that we have to know about recording? Hearing none, I guess we would move on to the minutes of June 16, 2020. I reviewed them, Roger Christian, and find them acceptable. Carol?
I second that, Carol Ahern.
Thank you. We will take the meetings as accepted. Moving on, may we have your report, Jared?
Sure, thank you. And first, I'd like to welcome you as chair, Roger.
Thank you.
Look forward to a long and prosperous relationship. Okay, so obviously, if you've been following the numbers over the last few weeks, we've seen in Westwood a steady uptick in positive COVID-19 cases. We currently are on pace to eclipse our August total, which ended up being adjusted to 15. So far in September, we have 7 positive cases. And we're just about halfway through. So we, as always, encourage the community to, practice social distancing, wear their face coverings when they're required, to limit their attendance at gatherings, to practice good hand hygiene, stay home when sick, and follow the governor's advisory on travel. So we are placed in the category of yellow, which denotes the 14-day case count between 4 and 8 per 100,000 people. We've been in that yellow designation for about 3 weeks now. Hopefully cases will decrease and we can move back into green, but being a 14-day average, it does take a little bit of time for the numbers to move one way or the other. Our testing positivity rate is around 1.2%, which is pretty level with the last few weeks, so that hasn't really fluctuated too much. In terms of other issues, we did just finish the renewals of our food establishment permits. If you recall, the board had voted to extend the expiration dates from May 31st till August 31st. So I believe that just about everybody has renewed. There might be one or two people we're still trying to track down, either who are not operating out of their current brick and mortar, or are just not in their offices to see our emails. So we're continuing to follow up with the last few, but the majority of our food establishments have been renewed. So that is welcome news for us. And Jason's been hard at work getting caught up with routine food inspections. So I believe we're pretty close to being caught up to where we were pre-shutdown. He's been working very hard, so I'm optimistic we'll be where we need to be by the end of the year. So that's kind of it for my report. I wanted to spend the bulk of the time kind of discussing the reopening of the schools, so that we can kind of discuss the metrics. I think a lot of people are curious, have wondered what type of metrics or benchmarks we're going to be looking at in conference with the school department to determine the overall safety of the back to school hybrid model. So sourcing, information from many different municipalities, from CDC, from DESE, from Mass DPH. The four metrics I've kind of been focusing on would be the average daily incidence per 100,000 residents, which is the 14-day snapshot that gets reported weekly by Mass DPH, which is also tied into that color coding. Red would be above 8, and that would sort of be the benchmark where we would look at that as being evidence that there could be some community spread. The testing positivity rate would be the second in Westwood. I've set that at about 4% for us to look at. If our testing rate rises above 4%, that would signal to us that there may be some community spread. Currently, we're at about 1.2. The other two metrics are basically mirrors of those two and focus on state level statistics. So we would be looking at average incidence per 100,000 on the state level, and the average or the testing positivity rate in the state of Massachusetts being above 4%. So I think utilizing a mosaic of those four benchmarks will give us pretty good idea of where we are in terms of community spread of COVID-19 as schools resume, and it'll give us jump-in points to work with our partners on the school side to have a better handle on any cases that might be present there. So that's kind of where we have it. We have established a communication line with the COVID team over at the public schools. Karen Pareda is heading that up on the school side. So that team and our office will be in communication should any cases get reported, probable suspect or confirmed in any of the schools. They will loop us in so that we can have a conversation as to what the appropriate next steps are. So it'll be up to us to be able to weigh in, as well as utilize the epidemiologists at DPH if we need any additional guidance to make sure we're in the best position to make appropriate decisions when we advise the schools what our opinion is on whether or not it's safe for schools to resume either in part or in whole. So that's kind of where we are. Go ahead, Roger.
Question about Zavarian. Are they on their own in terms of what their relationship to the town is and what they would do about opening and closing?
Zavarian has a plan. It was submitted to me for review. It's very comprehensive. So I trust through my conversations with them that we'll be looped in, since any cases in that building would not necessarily be Westwood residents, but it would be in on our soil, for lack of a better term. So we would definitely want to know about it. So, we do have a communication line open with them as well.
Thank you.
So, yeah, I mean, I think the important takeaway for us is that, we're looking at a collaborative approach to this. Obviously, there's an increased sense of, I guess, anxiety. I think a lot of the stakeholders in the public school community are looking for information. I think each of these situations would be handled on a case-by-case basis, depending on where, what information is available to us at the time. So it's hard to speak in generalities or hypotheticals, but if we get evidence, if we get reports or we have evidence that there are cases or probable cases or suspect cases with school or staff or close contacts of those individuals, we will work them all out. The contact tracing will be done on the Board of Health level for the school department. And they have a very solid team already in place, and they're looking to add to that group as well, so that we're able to share information and make the appropriate decisions when they need to be made as to what the overall safety of in-person learning would be.
Very good.
Good. So I'll just give my 2 cents worth that I'm at a school in another town, and we've been in person for a week. And I have to say, we've been quite successful. We've had a couple of kids with like congestion or sore throat. They've tested negative. But I have to say a praise to the faculty and administration that we worked all summer over protocols, and it's going very smoothly. There is a little anxiety underneath it all between faculty and students, but overall, we've just tomorrow will be a week, and they feel very successful. So we're hoping, and a major thing too, and I know the schools know this, is communication to the parents. That's just one thing that parents totally appreciate. And I think that's a big thing. So, yeah. So let's hope Westwood goes just as well.
No, well, that's great news. The team that's in place and the plan that's in place is very, very solid. So I think we have as good a chance of being successful here as anyone. It's obvious reading through the document that many, many people on the school side worked very, very hard to put it together. So I'm optimistic that we will do as good a job as can be expected. So obviously there are always issues, but I think we have a great plan in place.
Good.
Okay.
Thank you.
All right. So I'll touch on the flu clinic briefly. So we are planning to hold an annual flu clinic. This year, the plan is to partner with the wellness division at Wegmans to hold the annual clinic. We haven't set the date yet. We have a couple of dates that we are working on, either late October or early November. Most likely the clinic would be held outdoors at the high school. The clinicians who work for the wellness division in Wegmans will be the individuals administering the flu vaccine. There will be a sign-up app or sign-up web page, which will direct residents to log in for a time slot for themselves or their family, and kind of show up a few minutes before their appointment and kind of be ushered through the different phases of the line in order to get their flu vaccine. So it seems like we're still ironing out a few of the details. with the group there at Wegmans, but I'm very optimistic we'll be able to make an announcement of a day and time very shortly, so that our residents will have the opportunity, if they would like it, to have their flu shot done here. As always, we're encouraging everyone not to wait. If they have the opportunity to get their flu shot at an earlier, more convenient time or location for themselves and their families, they should utilize that. With the additional requirement this year that the school-age children be vaccinated, we want to make sure every resident who wishes to get their flu shot gets it as soon as it's available to them, so as they're not left without as we head into the flu season.
So Jared, are you going to need any volunteers?
As of right now, clinicians probably we're not. They're going to handle that. We may need a volunteer or two to help with sort of directing people through different waiting areas. But we're still working out the sort of the field plan of how we're going to do that. So we may or may not, but the clinician side is going to be handled by them, which is a relief because they'll have enhanced PPE and other things that our group may not have had access to, and it's hard to plan when we don't know what we're going to be with or how many volunteers would be willing to volunteer. Typical or traditionally. So yeah, more information will come on that, but I feel like they have a pretty good plan in place for running their clinics. We're going to supply the tents and the tables and chairs and a few volunteers maybe, but the rest of it will be handled by their people. So it'll be a really beneficial partnership for us, especially this year, and maybe something moving forward we may continue.
Good.
Very good.
All right, so our next item obviously is the vacancy left when Tiffany McCarthy left us. So we are moving along with an open position. We have been taking resumes, and we are in the process of scheduling interviews to replace Tiffany's position. So Joan is handling that up at HR. So we're going to have a schedule hopefully soon of candidates who have been invited in for interviews and when those interviews might be. I don't have a timeline as to when we might have a candidate selected. I think it's still a little bit early in the process. So we will we'll move along without a person in that spot for now. And hopefully we'll have somebody on board very soon. Just take a quick minute to thank Tiffany, if she's watching. Probably not. But obviously everybody here knows how grateful I am for her service during my time here, especially over the last 7 months, as we fought through the pandemic and all that it entailed. Her role here was irreplaceable, and so she obviously is going to be missed, but we need to identify another candidate and move on. So I'm grateful for the time she spent here and the work that she did with us, but we are looking forward to moving on and welcoming someone new to our team.
Good.
Very good. Thank you.
Good.
And the last item, I guess, would be the vacancy on the board. So with Jim O'Sullivan not being reappointed, obviously the two of you are aware we have a vacancy. We will go through the process of finding a replacement board member. My preference is to wait until after we've onboarded the staff member, because to me, we can still conduct our business with two members, and we need to staff that nursing position as soon as possible. So my plan was to staff that position and then turn our attention to replacing the third member. I don't know if you have thoughts on that, but that's kind of where I am.
Oh, that's fine.
How do we seek a new board member? Is there a,
It is
And-
it's posted on, I believe the vacancy is posted on the town site, and there's instructions there for residents who are interested in being considered to express that through the town administrator's office. So I think that it starts there. I believe I've had one or two residents reach out, and their information has been sent to us. So I believe it's all going through the town administrator's office. The appointment, I believe, would have to come through the select board. So it would, it's a little more involved than replacing an employee. So there's some alignment that would need to be done between the process and the different town entities that need to weigh in and co-sign. So more to come on that.
thank you.
Okay. And I don't know if there are any questions in the queue or anyone is out there who has questions or concerns that Erica has been able to field.
We have one hand raised,
Okay.
but nothing in the Q&A.
Okay. Were they able to type in their question or relay their question to you?
Everyone watching should be able to type into the Q&A portion at the bottom.
Okay. Okay, so if anyone is online watching who would like to ask a question, you can type your question in to the question box, and then we will answer it. Please also include your name and address that's needed for the record. All right, so we'll give people a few minutes to do that if they have questions popping up. Okay. I'm reading it. Okay, so this question comes from Antillon Grasso, 44 Oak Street. And I am a Westwood resident, a concerned parent of a second grader and a sixth grader in WPS, and as a member of Bring Kids Back MA, a 100% parent-run group advocating to safely get our children back in the classroom. I have questions on topics related to COVID-19 and the Westwood School reopening plan, the physical, mental, and social well-being of the 3,000 school children, particularly our most vulnerable young students in grades 2nd and 3rd, and the Westwood COVID-19 metrics supporting a full in-person return. Okay, so related to well-being, okay. As experts on our children's well-being, the AAP came out with age-specific guidance that considered both reducing, not eliminating the risk of COVID, and also the physical, social, and mental health of our children. They stated repeatedly that certain strategies taken, like reducing class sizes and reducing classmate interactions in elementary schools, may not provide enough COVID-19 risk reduction to justify potential harms. How is the Board of Health factoring in the AAP's guidance into their recommendations for school reopening? I repeatedly hear the preface out of an abundance of caution when related to school policies and decisions related to COVID-19. When are we going to start using this phrase for decisions related to our children's well-being? Okay, so the AAP, I assume, is the American Academy of Pediatrics. I think we fully recognize that their opinions have differed from both DESE and DPH opinions. I would say, speaking for the health side, it's really a matter of managing multiple stakeholders, you know, staff members, as well as the students and the parents of those students, I guess all have differing opinions on the safety of the resumption of in-school learning for the full cohort, not just the split hybrid. I think from public health, I think the 6 feet of separation designation is one that sort of hasn't borne itself out. You know, the original guidance from DESE had a 3 feet being sort of minimum and 6 feet being ideal framework. And I think most school boards have focused on the 6 foot, and for public health purposes, you know, we have utilized the 6 feet of separation in conjunction with a face covering as being the sort of the standard for safety. So I think for our purposes, unless Carol or Roger, you know, you disagree, I think for our purposes, the standard of safety would be 6 feet of separation and masks. So, you know, the sizes of our classrooms, I don't think can accommodate the full contingent of students with that designation. So I think that's kind of a stumbling block that we're all kind of trying to reconcile. Okay. All right, so it goes on. Our positivity rate is 1.18 and remained around 1% since July, with the exception of 1 week. The CDC and WHO both recommend in-person schooling when community positivity rates are lower than 5%. We have consistently been well below this benchmark and yet are in a hybrid model. If our children, in particularly marginalized populations of grade 2 or 3, don't return to full in-person now with these exceptionally low metrics, when will they? What do the metrics look like for full in-person return? You know, those questions are probably better served going through the school department. The Department of Elementary and Secondary Education is responsible for outlining what they believe equates to a safe return of students to the classroom. So that really comes from their side. Our position is to provide support for wellness and to minimize the risk of infection of COVID-19. So I think that there's maybe not a linear relationship there between what the Department of Public Health and the Department of Elementary and Secondary Education. I guess the viewpoints maybe differ slightly. There are many towns across the Commonwealth that have opted for fully remote learning, which have numbers similar to Westwood's. So I think specifics would need to come from the school department as to the reasons why they made the decisions that they made. And they are in line with the governor's directives. If they're not 100%, you know, they're within the framework that has been laid out. All right, let's keep going. All right, we have a question. Okay, we have a question from Susan Kaufman. Susan, I didn't get your address. If you would be so kind as to type it in. Okay. Okay, I can go back to follow-ups from the previous question. Given its critical indicator, why is this exceptionally low positivity rate not being shared in the Westwood weekly updates? Other states, well, the percent positivity rate is included in the Mass DPH weekly report. We were sharing different data. I'm certain we can add percent positivity rate to that format so that it's available in a second visual context other than the DPH report. I can get with Town Hall and we can make that work. So thank you for that suggestion. Rhode Island, Connecticut, New York have similar low positivity rates and schools have returned to full in-person. Why not Westwood? Again, I apologize. That better question for the school department. That, this is their bailiwick, that, we are working in collaboration with them to put the framework in place for a safe return. But the metrics that sort of describe what that return looks like is under the purview of the Department of Elementary and Secondary Education. So it really is on their side of the situation to determine. All right, Susan Kaufman is 33 Ridgewood. Okay, Susan, thank you. Our policy regarding parties held without masks and social distancing to deter Westwood having virus spikes like what happened in Dedham and Dover. Our policy has been that anyone who cannot maintain 6 feet of separation from another individual who is not a member of their immediate household should be wearing a mask if their interaction is to be longer than 15 minutes. When we talk about private property and private gatherings, obviously that's an enforcement issue. It is very challenging for us to try to enforce private property gatherings, given our staffing levels, especially when these gatherings most likely happen at night and on weekends, when our staff is not in the office. We try to message, the positive, proper regulations on what everybody should be doing to keep each other safe. Obviously, not everyone is 100% compliant with that in different environments throughout the town. There are potential fines we're allowed to issue up to $300 per incident. We have not issued any fines to any residents as of yet for these violations. We have issued a fine to a business so far. So, we're still trying to message properly and get everybody on board, realizing that they need to follow the mask regulations. When people don't comply, we do our best to educate them and to encourage proper mask use. But again, it's a difficult endeavor for our department to police this issue when they're nighttime and weekend events, and our office is not available at those times. Okay. Another question regarding Governor Baker's yellow, red, green map that is referenced in the weekly Board of Health communications about our positive cases. At a population of 16,000, Westwood moves from green to yellow with just 0.6 positive cases per day, and from yellow to red with just 1.3 cases per day. What is the goal? 0. The goal is an even 0 with the flu, which has had a vaccination for decades. The color-coded chart is a statewide metric designed to give residents sort of a general idea of quote unquote how their community is doing. A goal, I think our goal on the local level is to minimize to the greatest extent possible the spread of the virus within our community. Our goal, a goal would be 0, but obviously 0 is not probable or likely, but our goal is to keep our cases as low as possible on the Board of Health level. And it is something we work at every day. similar. That goal isn't even zero with the flu. Well, the flu and the COVID-19, I think we would treat those two separately. Trying to just deal with our situation here on the local level, and reduce our case count as much as possible, so that we can resume the activities that we have worked our way toward being allowed to resume, post government shutdown. So last question. I understand our community case counts include both residents in senior living facilities as well as college students with home addresses in Westwood, even if they were not physically present in Westwood. How are cases coming from these populations being addressed in the community updates to prevent undue alarm? Out of abundance of caution, our children's well-being and to limit overreactions, will Board of Health qualify weekly positive cases as being school-based transmissions versus others? I don't believe Board of Health will qualify. We are not prohibited to give any identifying information. Our cases will be included in the metric or in the chart or the graphs that will show an uptick in the 0 to 19 category, which would indicate school-age children. I know the school side is working on some communication pieces that will provide a little bit greater detail on the transmissions of the age or the age ranges of transmissions, in different settings. So the nursing home cases are categorized in the similar manner. They are included in the weekly totals, and they are represented on our chart by the age group. It does not differentiate whether someone is of a certain age and they are at home or they are in a congregate care facility. There is state level data weekly that comes out that has congregate level care statistics. So there is the potential to sort of cross-reference that. The university students who are testing positive and coming back to quarantine in Westwood, that is an issue we have dealt with where there are college students coming back to Westwood to quarantine are being counted amongst our cases, being that while they are infectious, they are in our community recovering. So they do count for us for our totals because they are present in our community. So that has been added to the case count matrix over the last few weeks. And we are seeing those pop up in our totals. To me, they're still here. They're not on campus recovering in another town or another state and being counted in our total. The cases that are being counted, that's their address. Their permanent address is Westwood. So that's how they're coming to be put into our totals. All right, let's see any more. It is ultimately WPS's decision to reopen schools, but as a partner to WPS in the recommendations, the health of our children should be paramount. Could you speak more about why MMass stats overall would be a factor in closing a school in Westwood? Our children are truly suffering by not being back in the classroom. So the benchmarks are, it's more of my thought is it's more of a mosaic. So what we need to do is be on the lookout for, increases that would indicate the spread of the virus throughout the Commonwealth would be increasing. Obviously, as many residents return to work and work in communities or towns where they don't reside, I think we need to have the macro and the micro picture of what is happening in the state in terms of transmission rates in order to best prepare ourselves for what may impact Westwood. So in my opinion, it's looking at the larger picture to see what will then possibly affect us if we don't take additional action to curb any potential spread. So, the Board of Health is looking at reducing the risk of transmission as the primary. Obviously, we're sensitive to the other issues regarding children's social emotional health. And, we are cognizant of the strain that it's put on many families. I think at this point, the case counts need to be monitored. And if the school committee or school department at a later date feels like they're ready to reassess what their models or plans are, that would be back on their purview. And we do have metrics, or we do have, activities in place that allow for social. We do have youth sports. Many have been back. We do have other activities, dance, other, academics, drama. So there are other venues, I guess, for social emotional outside of just being in school. So we're obviously, the rec department has a very robust schedule. Hale has some programming as well. So I think, the goal is to piece together a full experience for our school age children through different avenues, not all being provided in a school setting. I think that is kind of how this is all fallen into place and where we are at this point. Okay. Discussions with other facilities that have been successful in reopening to see how they have been successful to advise the schools. Okay, so I think the big piece of that is, we went through with summer camps and sports, resumption of sports and other things. And I think the big difference there is that, a lot of those were outdoors. The majority of the time that the groups were together, they were outdoors, and they were required for the most part to have masks. So I think the big difference is how the indoor air quality environment would impact the spread of COVID. So I think I would say by and large our summer programs were very successful, that I don't have any cases being reported out of any of the camps that or rec department programs that occurred over the summer. But I believe it's an outdoor versus indoor type of scenario. So I think, that is the most likely reason why case counts remained at the 0 level. From our data anyway. There may have been a case out there we just weren't aware of that didn't get reported, but so that's kind of the big difference, is to see how this how this cohorting, or how this smaller group is impacted once they're back indoors. So it seems like a cautious approach, which may not satisfy everyone's needs, but I think based on all of the factors we're trying to consider, it's a reasonable first step, and hopeful that we can build on that in due time. That's kind of the way I see it at this point. Don't know if I have any other new questions. I think that was all of them. If there's anyone else out there who has any additional questions, bear with me. I'm learning how to use this in real time. Erica, I think I've answered everyone. If you could confirm for me that that's true.
I am not seeing any more questions.
Okay. Then that's everything that I have. Do you, Roger or Carol?
I just wanted to point out that the weekly data that the state puts out that gives all the color coding does include the percentage of positive tests per town.
Yeah, I think the questioner was asking if we could include that on the weekly update that comes from Town Hall,
Okay,
which we can. We're able to modify that. We were putting just the kind of case increases to the right. We can include that statistic so it's easier for people to access.
Mhm.
That's
Okay.
that's an easy one. We'll do that, right? We'll do that. I'll get with Town Hall tomorrow and see if we can get it on the report that's going to come out on Thursday.
It's also interesting to look at what our neighboring towns are doing in terms of the data that they publish in terms of the case counts and all the rest. Also, one can go to see what the county is doing as well. I learned that when we tried to go to Vermont and had to state that we had fewer than 400 cases per 100,000 people in our county.
Yeah, that's a difficult task for any health agent in Massachusetts to try to determine.
Yes.
We're one of a very few states that has such local operations in terms of boards of health. So, I would venture to say almost every state except Massachusetts is on a county system, which is, I think, why Vermont was looking for that number. I did get that question one other time by another individual going to Vermont, and they said, "What is our case count per county?" And I said, "Well, I mean, that's going to be complicated. So, you have to add up all the towns in the county and then divide by the population and multiply." And yeah, it was quite the exercise to try to figure it out because, the data isn't always reported in that way here. Which in a lot of ways is beneficial now that we're able to actually get the data. I think the big difference between where we are now and where we were at the beginning of this was the availability and the reliability of the data. It was very hard to make comments or determinations. There was so much wiggle and so much gray in the data that things were being reported in real time that didn't add up when you looked at it all as a whole, and it made you question the reliability of it. So our reporting is much more sophisticated, much more timely, which is great. So it's easier for us to update this and include that information in multiple sources for the community to have access to. Yeah.
Thank you.
All right, so that's everything that I have. If you don't have anything either, then either of you can make a motion to adjourn, and I think that'll just about do it for us for this meeting.
I make a motion to adjourn today's meeting. Carol Ahern.
And Roger Christian seconds that motion. And having said that, I hereby declare that our meeting is adjourned. Thank you, everyone.
Thank you.
Thank you, guys.
Thank you.
Good to
I think you still have to vote, so you would ask Carol first, and then she would vote, and then you would vote after.
Oh, okay, after we've made the motion.
Correct.
Good, good. I'm glad you're keeping.
I read Robert's rules, Roger.
Thank you. All right. I then ask for a vote whether we adjourn.
Okay.
All those in favor say aye.
Aye.
And Roger Christian says aye as well.
Carol Ahern. Okay.
Okay.
Great.
I think that does it.
That's a
Good.
wrap.